Pear Suite is like the Salesforce for social care. We build social profiles for each member to understand their strengths, challenges, needs, and interests while generating actionable data. Hello, everyone. My name is Colby Takeda. I'm the co-founder and CEO of Pear Suite. In addition to myself, we have a strong team with backgrounds in healthcare, aging, technology, and workforce development. Our total health count is now 14 FTEs, and we're supported by experienced and engaged advisors. At Pear Suite, we're all about building care navigation software for community health workers to better assess and address the social determinants of health. These are my grandparents, and despite working with hundreds of older adults over the years with my career in aging, I painfully struggled to help my own grandparents as I got older. Over time, grandma struggled to handle her own meals and take her medications. And when grandpa stopped driving, he missed doctor appointments and couldn't get out to see his own checks. My grandparents are not alone. There are over 20 million older adults that cannot safely live in their own homes. Food access, social connections, home safety, and purpose. These are the social drivers of health, and they are actually critical to supporting well-being and independence and often not addressed. When the social determinants of health are ignored, the cost of care can skyrocket in excess of $100 billion annually. The good news is that there are thousands of social resources out there. There are also many well-trained community health workers and health coaches and care navigators that are compassionate, bilingual, and understand the cultures of the communities in which they serve. Unfortunately, the ways in which these groups interact are often erratic, delayed, and inefficient. And that's really where Pear Suite comes in. Pear Suite is a social care navigation platform for community health workers. With our platforms, staff can better collect, visualize, understand, and act on social determinants of health data in culturally sensitive, person-centered ways. And here's how it works. Pear Suite is like the Salesforce for social care. We build social profiles for each member to understand their strengths, challenges, needs, and interests while generating actionable data. Staff have an easy-to-use dashboard to drive consistent member interactions. And using text and phone, they can proactively engage with members in a tech-enabled, person-centered way. Staff are empowered to build strong, trusted relationships and provide culturally sensitive health education, onboarding support, and referrals to benefit programs and community partners, which are all guided by automatic recommendations and goal tracking tools. We truly close the loop, and our platform gives staff the ability to track members along various care journeys, receive decision support along the way, and seamlessly add billing codes like outcome measures and progress measures, and generate progress notes along the way. Pear Suite replaces paper assessments and Excel spreadsheets to revolutionize the social care navigation experience. With our platform, health organizations can increase member engagement, health outcomes, and revenue while lowering healthcare costs. Since launching in March of 2021, we have worked with 17 healthcare customers to impact over 20,000 lives. And our financials demonstrate strong market interest. In November, we hit over 130,000 in monthly revenue. With Pear Suite, member engagement has improved to 62%, more than double the industry average. And our users love using the platform, expressing 95% satisfaction rates. Not to mention, we've been able to help staff increase efficiencies by 3x. We make money through a monthly or annual subscription based on the size of the population and number of users on the platform. And we sell to community health centers, social service providers, and other digital health companies that need care navigation software. Over time, we plan to also sell to Medicaid and Medicare Advantage health plans and have our first plan starting in January. Over 10,000 older adults turn 65 every single day. And because of the recent policy changes and the national shift toward value-based care, the social care software market is worth over $10 billion. We are currently oversubscribed for a $2 million seed round, but we're always open to meeting new investors. We'd love introductions to key healthcare leaders that need software to empower community health workers, adults who need to address health inequities in culturally sensitive ways. We're also looking to meet industry partners such as healthcare innovation teams and think tanks, and to help distribute our platform to more organizations. At Pear Suite, we know that relationships are the key to solving every other social determinant of health. And with our platform, healthcare organizations can now cost-effectively build strong relationships to address these social challenges. Thank you so very much. We look forward to connecting.
Thank you, Colby. Great job. Can you share a little more about the national and local policy changes you mentioned there at the end? I know some of those are really impacting how customers can use your platform.
Yeah, absolutely. In addition to the shift toward value-based care, we're seeing CMS introduce new codes and new ways for providers to actually get reimbursed for some of the social care referrals and social screens they're doing. There's about 25 states right now that actually have Medicaid reimbursement codes to allow community health workers to do care navigation, care linking, health education, and other navigation services to promote things like vaccinations and screenings. So really excited about that movement.
That's awesome. And talk to us about what types of new partnerships you're seeking. If you could prioritize them, what would really help you make the biggest impact?
Yeah, lots of organizations want to do this work. You know, they have the staff in place, they might have some money, but they don't know how to execute. And so I think organizations that can help us roll this out in very productive ways and help build systems and processes, even with helping with training and with community health workers, have been really key. We're working with several FQHCs that have really national presence and have built out really strong training programs to kind of escalate and scale their work. And we love organizations that have an interest in addressing social health, determinants of health needs for different specific disease states, like heart disease or diabetes care or dementia and Alzheimer's.
Congrats on the oversubscribed round, by the way. So just curious, that leads me to ask, what does the competitive landscape look like for you all?
Yeah, certainly. There's a lot of organizations that have, point solutions. Some organizations just do resource linking or will send you, referrals out to other organizations. So we're seeing this closed loop being an issue, right? They don't get any data back. They don't know what's happening after referrals are made. There's other solutions that provide maybe hand holding for different enrollment programs, like helping them register for SNAP benefits or helping them get onto Medicaid. We do all of that all together. So this person-centered way to get all of these things done comprehensively from end to end, and empowering staff who are on the ground, who know the culture and the background of the people that they're serving, is really our solution to addressing this challenge.